My name is Angie Sellers, and I'm going to be doing your foot exam today, okay? The first thing that I'm going to do is look and test your musculoskeletal system. We want to make sure that you have good range of motion in your foot in order to prevent any kind of abnormalities in the pressure in your foot and the way that you land on it. Any type of pressure can cause or set you up to a skin breakdown, especially if you're having problems with the sensation in your foot and you can't feel it. So first, I just want to make sure that you can bend your foot correctly. If you're not and you can't bend your foot when you walk, it causes too much pressure on the front of your foot, which can cause breakdown. Then we look at the position of your toes and make sure that they are flexed correctly. If they're flexed back too far, when you walk, it puts too much pressure on your metatarsal heads here on the ball of your, or the top of your foot, and then that also causes more pressure. Also, just look at the general shape and everything of your foot. I make sure that you don't have what's called a Charcot injury, which can cause inflammation on the top of your foot, but also can cause a deformity on the bottom of your foot where it's rounded, and that also causes a difference in the pressure and everything on your foot and the way that you walk. Next, I'm just going to look at your skin. Make sure that it is all intact, that there's no excess dry skin or cracks. Make sure there's no ulcers. We also look between your toes to make sure that there's nothing, no kind of cracks or tears. Make sure there's you don't have athlete's feet, which tends to grow in between your toes. We also look at your nails. If you have thickened nails, it could be a sign of a fungal infection. And then if you have any kind of ingrown toes, it can also set you up for an infection. Next, we're going to look at your circulatory system. Diabetes can cause or affect your vascular system and can cause a decrease in your blood flow to your foot. And you need blood in your feet to make sure that if you do get a wound or a cut, it will promote healing. You have to have a good blood supply. And then also, if your blood supply is cut off, the opposite occurs and you'll have difficult healing and can cause ischemia in your foot. I'm going to check your pulses. You have 2 pulses in your foot. You have the dorsus pedis, and then you also have the posterior tibial. And your pulses are good. If your pulses couldn't be felt, then we would probably need to do an ankle brachial index on you. And that involves a blood pressure cuff and a Doppler ultrasound to check the blood flow in your foot. We make sure that your temperature of your foot is not too cold, not too hot. If it's too cold, it means you're not getting a good blood supply. If it's too hot, it could be a sign of infection. We're also going to check your capillary refill. You can either press the top of your toe. It's a little more difficult on the nails of your feet, but if you press the top of your toes, it will go white and you release it, and the blood flow should return in less than 3 seconds. So that way you know you have adequate blood flow in your foot. Next, we are going to check your neurological, your nerve sensation in your foot. Diabetes actually slows down the nerve conduction on your nerves, and so you get neuropathy, which can actually be a painful tingling or could be a numbness. And if you have any kind of numbness, then also you don't know if you've hurt your foot. So one of the ways we test is to make sure you still have your protective sensation. So that way, if you're out walking or if you're barefoot or if you do get an injury, if you've lost that sensation, you may not know that you actually have that injury on your foot or a cut. Now this is a monofilament, and I'm going to push on your foot and see your arm. Okay, and you should be able, you feel that?
Yes.
Okay, so, and I'm going to ask you to close your eyes, and I'm going to press it on different areas of your foot and see if you can feel it. Okay? You feel that?
Yes.
Secondly, I'm going to check and see if you can tell the difference between a dull and a sharp. I can see your hand again. Just feel the top of the cotton tip, and then that's a little more sharp. Okay?
That's sharp.
Okay.
Sharp.
That?
Sharp.
No. You feel that it's sharp? Okay.
I feel it.
Do you feel sharp?
Yes.
Okay. And what's that?
Dull.
Okay. Very good. All right. Now, I'm going to check to see if you can feel vibration in your feet. Okay. That's also a good indication if you are at risk of developing any kind of ulcer. Okay. Now, when I bang this and put this on your toe, you're going to tell me when you can't feel it, the vibrations anymore, and then I'll also know if I'm still feeling it here in the tuning fork as well. Okay. And just tell me when you don't feel it anymore.
Okay, I don't feel it anymore.
Okay. All right, and then next I'm going to check your reflexes. Of course, your reflexes will let us know if you have any kind of nerve damage in your foot as well. Okay. Let's see if I can get you positioned in a better position. Just relax your foot. Okay. All right. Now that completes the exam. Okay. And your foot was in good shape. Since you didn't have any kind of deficits, we would just need to check your foot yearly. If you did have a deformity in your foot and a loss of sensation, you would need to follow up in about 3 to 6 months. If you, and possibly need to see a surgeon if the deformity needed to be fixed. If you had some kind of arterial or blood flow problem and also had a loss of sensation, we would need to follow up with you in 2 to 3 months, and then you may need to see a vascular surgeon. And then also, if you did already have any kind of present ulcers or amputations, then we would need to see you in about 1 to 2 months, and then you probably also need to be seeing a surgeon or a vascular surgeon as well. Some things for you to remember is, first of all, always we need to make sure your glucose is in control, and make sure that you're not going sugars too high, so that way we can prevent or control any symptoms of the neuropathy. We need to make sure that you are washing and checking your feet every day. You need to make sure you're wearing good shoes that fit your foot well, that doesn't cause any kind of rubbing or blisters. You need to make sure you don't go barefoot. If you go barefoot and you do get a cut and you had any kind of loss of sensation, then you're not going to know that it's there. And then lastly, you need to make sure that if you do have something wrong with your foot, such as an ingrown tail or ingrown toenail, you just need to make sure that you don't treat that yourself. You come to the clinic and let us treat it, so that way you don't cause any sort of worse cuts or infections. And we are completed with your foot exam.
Thank you.